Its usefulness might be debatable, but some business owners in Colombia's capital are going to the extreme of mass spraying disinfectant on people to control the spread of coronavirus, as crowds throng malls and streets for the holiday season. Health officials are also worried. Cases have gone up in recent weeks. In Bogota, authorities have stepped up their testing campaigns in parks, streets and plazas.
People have totally lowered their guard. I see it among my friends and this is very worrying. I'm watching the news on TV and I fear what's been happening in Europe and the US will be even worse here if we don't protect ourselves.
Colombia's just surpassed 40,000 COVID-19 deaths and on Friday reached a new record for daily confirmed cases as people gather in increasing numbers ahead of the Christmas holidays. Intensive care units are again reaching full capacity in a number of provinces. From Bogota to Cali and Medellin, local authorities are announcing new restrictions on restaurants and bars and imposing curfews. But there's a silver lining. The government has announced a deal with pharmaceutical companies Pfizer and AstraZeneca to provide 20 million doses of COVID-19 vaccines in 2021. Another 20 million could arrive through the COVAX mechanism, geared toward helping less wealthy countries.
Our goal, as designed with COVAX and the pharmaceutical companies, is that for the first weeks of 2021, we will be starting the process of mass vaccination.
But despite the optimistic announcement, the plan is to vaccinate only 2 million people in the first trimester of next year, starting with healthcare workers and those with pre-existing conditions. With true mass vaccination still far away, some medical experts believe the country remains ill-prepared to face many more months of new cases and deaths.
Many regions are already in an alarming situation in a health system with very limited capacity. It's true that there's been an increase in a number of ICUs in the country from 5,300 to 11,000. But that doesn't mean that we're able to attend more patients, that these new units have been fitted properly. We lack provision, medicines and doctors. The government should return to more drastic restrictive measures. But for now, many Colombians seem more interested in celebrating the season and their liberties while they last, even if the hangover could be deadly. Alessandro Rampietti, Al Jazeera, Bogota.